Hello everybody, I am Dr. Suresh Rao, Director of Mangalore Institute of Oncology. This is MIO Podcast, and today I would like to discuss about delay in cancer diagnosis in spite of evident warning signals. This almost I see every week, at least 4 or 5 patients uh, delay in diagnosis. So this is irrespective of their wealth, their education, and uh, rich and poor alike. So, this is why we try to create awareness and talk about warning signals, how the cancer, there are some symptoms which you should be able to pick early. Only then cancer can be diagnosed in first or second stage. And in that, you all of you know that cancer once diagnosed in first and second stage, 90% are curable. The reasons why people come late may be various, like they could have fear, they could think that cancer is just out of their mind, it may not be cancer at all, and some may be thinking of cost, some may be thinking of social issues, like ladies with breast cancer, why should I tell my children who are far away, it may be a difficulty to them. So multiple factors are there. Some are myths and some are social issues. Because we have cancer information centers in different parts of our district and Shimoga district, etc. So they are what we call as Mahithi Kendras. So we have appointed a staff and they are supposed to give information, and people who have doubts, they can come and speak to the volunteer there. Basically it is because people fear to come to a cancer hospital. So for to me, the volunteers were telling me from Mahithi Kendra, people are even afraid to walk near the Mahithi Kendra. They are afraid. What if somebody sees? What if they are diagnosed with cancer? So we have such a deep fear and sometimes myths about cancer. That's why we in the hospital, we always see most of the cancer in third or fourth stage. And all of you know, in third or fourth stage, you have to spend a lot of money, and success is limited compared to first and second stage, where it is very easy to treat and success is high, beyond 90% most of the times. Now, I will give you a few examples of patients who came to Mangalore Institute of Oncology in Pampel. Also, one or two patients actually came to MIO hospital in Tirthalli, and one in Udupi, our center there. So, all came irrespective of they are having warning signals for many times. So, this is not India alone. So, these some of the patients are in Western Europe and the Middle East. So, it is we should not think it is India, but the patients were all Indians. So, what has happened is there was one patient. Uh, she had bleeding, postmenopausal bleeding, we say. Like menopause generally is at 50, 52 years. That means a lady has every month periods, in a month 4 days bleeding. And then as you reach 45, slowly this becomes irregular, and at 50, 52, most of the time it stops. So this lady has postmenopausal bleeding. That means she was around 60. So her period stopped at 52. Then 8 years she had no bleeding. Not 8 years, 6 years. At 58 she had a drop of blood. So this is a very good example where diagnosis can be done very quickly. Even 30 years back, people used to diagnose this disease as stage 1, because the postmenopausal bleed is an example where you will go to the doctor. Now you see, it's very unfortunate for this lady. She is very wealthy. She looks after many businesses. All these things are there, and she has gone to doctors also in these 2 years for many a period. So there was some fibroid also associated, but we should always look at cancer as one of the main causes of postmenopausal bleed. So you have to do D&C, you have to do biopsy, you have to be very wary of postmenopausal bleed, the ladies. Unfortunately, 2 years um, it was delayed, and finally a surgery was done where the uterus was removed. The cervix was left behind, the uterus was removed. Again, this is a totally wrong thing to do in a postmenopausal bleed. Unless you know the diagnosis, you can't assume that it is a fibroid or a non-cancerous condition. You have to see very carefully, do MRI, see where there is enhancement, do D&C and confirm if it is cancer. Because for cancer, the surgery is totally different. And for fibroid, the surgery is totally different. Such a person with so much of probably knowledge, wealth, managing so many people, got her disease diagnosed around 2 years late. Of course, now we are dealing with some very difficult situation, because always in cancer, the first step should be the right step. Once you do a mistake on the first step, it's almost very difficult to retrieve the situation. So we tell for comfort not to worry other things, but we should remember that. This is one person who is wealthy, educated, who made a difficult decision. It's not totally her fault because she has gone to doctors multiple times. Doctors also sometimes assume that it is a fibroid. That's not the way to go. That's why we say awareness among patients itself or public is important, because doctors sometimes don't see cancer frequently unless you are an oncologist. So I don't blame always, but there are protocols on how to assess postmenopausal bleed. So this is simple fact that if there is postmenopausal bleed, you should think cancer as one of the important causes for it. And most of the times it's stage 1. Then there is one more person also. That person also is from Western Europe. He also had some difficulty in swallowing. And we should remember that in the West, especially in UK, Germany, France, most of the European countries also, where health is done by the government, things are very much delayed. And the process in a disease like cancer, delay cannot be an excuse for late diagnosis. So we should remember that India access is very good actually in that sense. So this person had some difficulty in swallowing and some weight loss, and he's around 64. So anybody above 50, any symptoms beyond 2 weeks, we should consider cancer as one of the likely causes. It may not be cancer, but it could be other problems also. Diabetics also, you lose weight uncontrolled. So many other causes. But cancer is one of the cause. And after 50, if you have any complaints, backache, throat pain, bleeding per rectum, indigestion, you should rule out cancer. So this is the dictum, not to fear. This fear is a big problem because there is no great solution to it. Education is the only way to remove the fear. So this person had swallowing difficulty. He went to a doctor in one of the European countries, and then they gave him some medicine because you can't access oncologist in those countries. There's a system where you have to go to your GP and then he has to diagnose. So that way he spent around 4.5 months, and then they gave him a CT scan and MRI appointment after 8 weeks. That means 2 months. So if it was cancer, then it's very wrong to make you wait for 2 months. So the systems which are in UK and Europe is generally a little bit of a collapse because they are not able to manage finance, deficient staff, and sometimes lack of clarity because protocols they have to follow. So what happened is he was very much worried. He was already 6 months losing weight. He lost 8 kgs. He's unable to swallow and he's feeling more and more difficulty every week. So then he came rushing to our hospital. He showed me all his reports, basic reports like blood tests. That's all was done. So he came to me, and I was surprised that in a Western country where we presume that they are more efficient, and most of the technology, of course, is from Western countries only, whatever drugs we are using, even the machinery we are using. But there itself, the delay is very high, and private is too costly for most people. Although we may think they are well off, but they can't access private hospitals in Western countries. So without insurance. So generally, government takes care. And then he came here, and then he was in total anxiety. His family is there, and all that issues are there. Suddenly, you can't shift from after 30 years from somewhere back to Mangalore and for diagnosis purpose. But anyway, he came, and the same day I knew it was malignancy, 90%, but tuberculosis was probably another cause. But I did endoscope the same day. After he came, I told him, "You wait for 3 hours. I'll do endoscope." Then I did a biopsy, core biopsy of that big nodal mass, and then next day I did PET scan. So basically, in 1.5 day, we did what they were unable to do for 6 months. So we got the diagnosis. It was lymphoma. On the fourth or fifth day, our pathologist, who is an oncopathologist, told it is high grade B cell lymphoma. Of course, then its chemotherapy has to be given. There's a lot of treatment, and it also was in stage 4. It was spread to his liver. There was some nodes in the pelvis, some in the intestine. So almost that much delay. I was surprised. So anyway, he went back actually because his family is there. He can't take chemotherapy every 3 weeks here. There may be visa issues, all these things. You need permission if you want to take treatment for a foreign citizen. He went back. But this again shows that sometimes even in Western countries, he could have come here early also. So he also waited for 6 months. So thinking that, and he was telling me, he was always telling the doctors, do biopsy, do scopy. But they said, no, this is our protocol. We'll give antibiotics. We'll wait for 3 weeks. So we can't deviate. So that was the issue for him. So this is the second patient. And one more patient is also very interesting. This is in India only. So patient had C esophagus. Esophagus is the food pipe. So that patient actually came in stage 1 as per the endoscopy report, very small lesion of 2 centimeters. So we wanted to do CT. Generally we do a CT scan, whether it is spread to the lymph nodes, liver, and nodes in the neck, etc. To stage. So once diagnosis is done, we generally stage the disease, whether it is first, second, or third, or fourth. So this patient, I told to do neck, chest, and liver CT, but it was costing 6,250. Actually, it's very less compared to anywhere else, including the government hospital. But she wanted to do it near her house in a government setup. So you won't believe it. We do it in 15 minutes, half an hour CT scan, 3 hours fasting, and then do CT neck to chest and liver. That's all. 15 minutes it will be done, and then by evening or next day report comes. So then we can start treatment. You know the stage, because esophagus is a very thin organ. It's like paper, 5 millimeters. It can spread very quickly. So we got that neck done, and chest and liver. You won't believe that this is in India. They called her 8 times to the hospital. She had to travel 45 kilometers. 8 times. Once for CT neck, plain and contrast. Once for CT chest, plain contrast. So 2 plus 2, 4 visits. Again, liver I asked. So abdomen they did, plain contrast. 6 visits for CT scan. And twice they said it's too busy or CT machine is down. So patient had to go 8 times. Contrast given 3 times. Only once was sufficient. I don't know the reasons, I don't know the rules. Like in UK, there may be a protocol here also. I am not sure. So we have to apply logic actually. But instead of getting the report in 2 days, it took almost 7 weeks, close to 2 months. By the time patient came, it was some lymph nodes were there. and her difficulty in swallowing was significantly increased. She was unable to swallow. Otherwise, she was able to eat, except very hard food. Most of it she was able to eat. So again here delay in diagnosis. Generally, probably it's very difficult to cure her. So every week we say survival drops. We see by week, not by months in cancer. Every week is a matter for us. So in MIO, we have very strict policy of doing every investigation in the least possible time and starting treatment by day 7. This is our policy. So it should be way in cancer actually. But our book says every week how much survival drops. All this is literature, scientific. We are not doing anything out of science. So it's not that we are hurrying, but this is the way it has to be done. We should not waste time in cancer on unnecessary tests and wait for reports for weeks together. This is not the way cancer is treated. So this is one more patient here. Then one more patient, another interesting patient, lady. So she is also a very young lady, just 36. She had breast cancer. It's again government setup in our system. So whether it is private or government, we have to be very logical and empathetic to the patient, because cancer is a disease where you have to apply your mind and you have to be empathetic. Only then you will know their anxiety, their fear, and do it like your own. So this young lady, she was having breast cancer, which is very unusual in 36, but although we see a lot now. So she underwent surgery, and then what happened is she was advised chemotherapy, and the chemotherapy dose was not calculated properly, almost half the actual dose. It's very bad actually. She will not respond probably. In oncology, the dose is very important. It's not like antibiotics. You can give 1 gram of ampicillin, you can give 500 milligram, you can change the dose depending on severity of infection. No, in oncology, if chemotherapy dose you reduce by 20%, 50% failure you will get. So if you give half the dose, you are in deep trouble actually. It's like not giving anything. So I don't know why it was done, but maybe to avoid toxicities, because when you give full dose of chemotherapy, the doctor is under high stress because patient will get a lot of side effects and he has to manage it, the medical oncologist. So he will get calls so many. If you give half the dose, then nothing will happen. So he can sleep well, the doctor. So I don't know what is the reason. Maybe fear, maybe lack of application, lack of knowledge. So this is another, we say how she came in first stage actually. So this is how we can uh, delay treatment or get poor outcomes if we don't do it properly. We don't get first stage frequently. The patient here went in first stage, but there was some issue in the healthcare delivery system. So this is not correct. And there was one more patient, he is very poor. This breast patient also is poor. They come under BPL card. So it's very difficult for them to access private. But nowadays with BPL card, all treatments are free actually, radiation, chemo, surgery. But in Karnataka, we have a strange situation. In India, nowhere it is there, where the patient has to bring a referral letter from the government hospital. So actually from Kerala, patients come and take your treatment with no referral letter. They just have to use their fingerprints and they get the letter. That was the initial objective of this Ayushman Bharat, that a person with BPL card can take treatment anywhere in India of his choice. So he has the freedom. So you should give freedom to the patient, because the money is by taxpayers. It is nobody's personal money. So, but unfortunately, in Karnataka, they have to go to the district hospital. So, a person from Baindur has to go to Karwar. All kinds of difficulties. Sick patients have to go by ambulance to get that letter. So, these are all difficulties only in our patients are facing. So, this BPL patient, she was not affordable to take treatment. So, she had no choice. Otherwise, she would have not agreed to full dose of half dose of chemotherapy. We will not do it if it is our family. So it's a really error, we can say, or negligence. We don't know where to put it. Lack of knowledge is considered error. Intentionally doing is considered negligence. In America, again and again, I stress this in most of my talk. The third cause of death is medical errors. First cancer, second heart, or first heart, second heart. In most states of America. Then comes this kind of errors. You operate on a patient who is not fit for surgery. So, lot of people die because of medical errors. So, education, the type of education we give, the practical knowledge they get is very important in decision making in medical profession. You can't wait, or you cannot tell I took the wrong decision later. Then by then everything is done. So, this is another problem for poor patients. And there was one more patient in Tirthali actually. So he has already stage 4 disease of the esophagus. And somebody in Bombay advised him PET scan. So he spent 25,000 and he did PET scan. So he is actually a very poor person and we have given all treatment for him. There is no further treatment that can be given. It should be only supportive or palliative care. But some family member of his suggested you do PET scan. So I spent 25,000. So people should think scientifically. Of course, there is a lot of trust deficit between doctor patient. So people listen to lot of advices and they try for their life. People are sometimes desperate, and it is true. When it is our life, we'll try to do whatever best possible. So these are few examples I'm giving where we should apply our mind. So we are very much focusing on early diagnosis and awareness in all our cancer information center. In 10 centers we have now. We want to increase it depending on how people take these centers and take benefit of it. We are doing the centers, it's no money to be paid there. So our intention is to see that people come at least in first or second stage. So I request all of you, especially above 45, to take any symptoms seriously, apply your logic, think properly. So don't listen to people. If something is happening in your body and the body is giving you signals, you should sit in a calm environment and think why it is happening, because it's not happening to everybody. So if you have diarrhea or constipation, not everybody gets diarrhea and constipation suddenly. So you have to think whether it is colon cancer. Similarly, there is blood. You should not self-diagnose it's piles, hemorrhoids, and all. It could be, but after 45, cancer is quite common. Rectal cancer. We see every month 10 to 15 rectal cancers, which was unheard of before, and everybody come after 1 or 2 years. So these are important signals that the body sends. So education, awareness is very important, and I request all of you to read little bit of early warning signals of each type of cancer. All cancers cannot be diagnosed in first stage like lung cancer or brain tumors, but 80% what we see, the bulk of cancers like head and neck, colorectal, breast, and endometrium, cervical, all these can be diagnosed quite early. So, with the symptoms that the patient presents in. And this is what I want to tell today, for you to get educated, remove the fear, because first and stage are curable. And then there is a news about mRNA vaccine also, which is from Russia. So it is like in during COVID time, they were trying to work out vaccines where the tumor tissue is removed and a personalized vaccine is created. For they have done it for colon cancer, but it is under trial. There is no approval. Anyway, maybe in the next podcast we can discuss more detail about this mRNA vaccine from Russia. So, with these few words, I wish you all good health and happiness. Thank you.